أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss little bit about aspiration pneumonia in horses. Aspiration pneumonia is an uncommon but very severe condition when present. It may be due to four reasons. Number one, regurgitation of food material in esophageal obstruction. Number two, pharyngeal paresis or paralysis. Number three is structural abnormality, means cleft palate in a foal. Number four, it may be induced intrapulmonary administration of medications, means wormers, milk inhalation in fostered foals, and partial drowning. So these were the reasons due to which aspiration pneumonia may occur in horses. Clinical signs: as for severe respiratory illness, clinical signs of principal cause, which is choke or choking, they may be seen in aspiration pneumonia, and the main clinical sign may be milk or wormer material coming down from the nose. This may be observed. Diagnosis: clinical signs. On the basis of clinical signs, we can diagnose about this disease, aspiration pneumonia. And number two, tracheal wash may confirm about the aspiration pneumonia. Confirmation of presence of foreign material will show that yes, this horse is suffering from aspiration pneumonia. So mind it please that there are four main reasons of aspiration pneumonia in horses. Number one, regurgitation of material, food material in esophageal obstruction. Number two, pharyngeal paresis or paralysis. Number three, structural abnormality, which may be cleft palate in foal. And number four, the reason may be induced, like intrapulmonary administration of medication, like wormers may be medicated, milk inhalation may be done in fostered foals, partial drowning may also be a reason. So when we are going to diagnose this disease, we must keep our eyes on the clinical signs, number one, and number two, on tracheal wash. If in tracheal wash there is presence of foreign material like milk or wormers, then it is confirmed that yes, horse is suffering from aspiration pneumonia. Treatment: so far as the treatment is concerned, antibacterial therapy should be done, number one. Number two, steroids in larger doses to limit the inflammatory response to irritating chemicals. So number one, antibacterial agents should be given to the horse, number one. Number two, steroids should be given according to the weight of the animal, and these steroids are given to prevent the inflammation which may be caused due to the presence of irritating chemicals. Number three, try suction if necessary following tracheotomy. Suction may also be tried if there is a need of that suction. Yes, this may be done, this should be done if needed, and after that tracheotomy may also be performed if needed. Food and water by stomach tube should be given if necessary, depending upon the severity of the problem. if there is more problem, more severe problem, then yes, stomach tube should be used for giving food and water. Crossed eye horse with head down. Horse should be cross-eyed with head down. This may also help to treat the aspiration pneumonia in horses. Prognosis depends upon, this prognosis actually depends upon the quantity and type of material inhaled. If quantity and the type of material is more and greater in size, then yes, there is less prognosis. And initially give a very guarded prognosis, but very guarded prognosis, and be prepared to revise it following subsequent examinations. If the cause is choke, if the cause of aspiration pneumonia is choking or choke, which is resolved, then the lungs do a remarkable job of resolving the problem. Lungs play remarkable job to resolve the problem. And if the cause is wormer, in our language we use the term deworming, actually it is worming. Medication of a chemical, of a medicine to remove the worms from the stomach is called as deworming. Actually it is worming. So if the cause is wormer, the prognosis is poor, and worse if food material is inhaled. So mind it please, if cause is wormer, prognosis is poor, and prognosis is worse if food material is inhaled. So when we tried tracheal wash, and when we confirm the presence of the wormer, and if there is presence of food material, then prognosis is very, very poor. So please inform the owner about the severity of the problem. This was a little bit about aspiration pneumonia in horses. So if there is some other problem, so please inform the owner about the severity of the problem. In time information will lead to the proper decision that owner will make about the horse. Thank you very much. Inshallah we will come with the next disease discussion about the horses or some other animals. Jazakallah. Allahumma salli ala Muhammadin wa ali Muhammad wa ajil farajahum.